Hello, my name is Carolina and this is the drawing of insulin. I'm going to use a 50 units insulin syringe, regular and NPH insulin vial. First, I will verify the healthcare provider's order. Next, I will verify the 6 rights of medication administration: right patient, right medication, right dose, right time, right route, and right documentation. Next, check the medication order in the EHR. And introduce myself to the patient with my first name, provide for patient privacy, identify the patient with his full name and date of birth, and those are the 2 patient identifiers. In addition, ask the patient if he has any known allergies to medication, food, seasonal allergies, or other. Perform hand hygiene and apply clean glove. Now I'm going to explain to the patient the purpose of my visit and maintaining eye contact with the patient. Okay, Mr. Lex, I am here because your doctor ordered insulin and is going to be injected subcutaneous every morning before breakfast. So insulin is a hormone that lowers glucose in the blood to control blood sugar in patients with diabetes mellitus. Some of the common side effects, those are very common, are dizziness and nausea. While injecting the insulin, you are going to feel a slight burning sensation or stinging sensation at the injection site. Some of the adverse effects are drowsiness, blurred vision, and muscle weakness. If you experience any of those adverse effects, let me know immediately to notify your doctor. Allow the patient to ask any questions. Prior to injecting the insulin, I will check the glucose level in the patient. An appropriate blood glucose level is 180 milligrams per deciliter. Inject the insulin 30 minutes prior to his next meal. Verify and check the medication order in the EHR or in the MAR, and calculate the total volume of combined insulin. So the doctor ordered 4 units of regular insulin and 8 units of NPH insulin for a total of the combined insulin. The volume is 12 units to be injected subcutaneous every morning before breakfast. So once I already calculated, I'm going to ask another nurse to come and verify my calculations. Once the nurse already verified the calculations, I'm going to go ahead, remove the vials from the drawer, let it cool down to the temperature to come to a room. Let it cool down to a room temperature. And both vials, I will check the expiration date and inspect the medication if it has any clumping, frosting, precipitation, or changing color. Roll both vials between my hands, and with an alcohol pad, wipe the rubber top of each vial. Now, with the cap still on, I'm going to fill the syringe with the prescribed order of NPH. I fill the syringe with air to the prescribed order of NPH insulin, which is 8 units. I'm going to remove the cap and I will inject the air into the NPH insulin vial. Inject the air, and while injecting the air, I make sure that the needle doesn't get in contact with the NPH medication. Now, I have here the regular insulin vial, and I'm going to fill the syringe with air to the prescribed order of regular insulin, which is 4 units of regular insulin. I'm going to inject the air into the regular insulin vial. Now I'm going to fill the syringe remove the vial, and now I'm going to tap the syringe to remove those bubbles. I push the plank to make sure that I remove the bubbles. Okay. Now I'm going to check and verify in the EHR or in the MAR that the correct prescribed order of regular insulin is 4 units. I check again on my syringe. I make sure that I have 4 units of regular insulin. Now, prior to filling the syringe with the NPH, I'm going to point the total combined volume of insulin, which is 12 units. So I make sure that I see what is the 12 units in my syringe. Now that I verify my syringe, I'm going to check in the EHR to confirm and make sure that the prescribed total volume of combined insulin is 12 units. Now that I did my safety checks that I pointed and that I checked in the EHR the total 12 units of combined insulin, I'm going to insert the syringe into my NPH vial. While I insert the syringe, I make sure that I don't push the plank so the regular insulin will not get injected into the NPH vial. Also, while withdrawing the medication, I make sure that I do not overdraw too much NPH into my syringe. Okay, now that I already withdraw the medication, I recheck again in my EHR or in the MAR that the total combined volume of insulin is 12 units, and again I check my syringe. I make sure that I have 12 units. Now I'm going to recap the syringe using the one-hand scoop method. Stabilize the cup, and if I fill the syringe away from the patient's bedside, then I will label the syringe, make sure that I put the full name, date of birth, and that I mark that there are 4 units of regular insulin and 8 units of NPH insulin for a total of combined insulin of 12 units. I inject the medication to the patient, clean up my area, remove my gloves, perform hand hygiene, and document the procedure.